I'm going to start with just an overview of some of the objectives of our talk today, and feel free to stop me at any time and ask questions. I have no problem with that. But I'm going to cover, first of all, the role of certification for asthma educators. I'm also on the National Asthma Educator Certification Board. I'm actually chair this year of that board, and that's the board that writes a national exam for individuals who would like to sit for that exam and become certified asthma educators. And I'll just touch on that briefly because that is sort of a prelude to getting reimbursed in our neck of the woods anyway. Our health plans are only paying for certified asthma educators. So I'm just going to go very quickly through that process, talk about our model of reimbursement, how we've been successful with that for 15 years, how that model has been replicated in other parts of the state, and what the evidence is for sustainable models of asthma education, including some case management models and some reimbursement models as well, and then other models of reimbursement outside of Michigan. I'm going to begin just with a real brief overview of the National Asthma Educator Certification Board. Anybody here a certified asthma educator? Okay. Yay. All right, a couple of us in the room. It is something that you may consider doing if you work with patients who have asthma and are performing the functions of an asthma educator. The mission statement of the board is to promote optimal asthma management and quality of life among individuals with asthma, their families, and communities by advancing excellence in asthma education through the certified asthma educator process. Why is certification important? Well, I got into asthma probably 20 some years ago in the early 90s. I actually have asthma. My daughter has asthma. She was diagnosed before I was. So she was diagnosed at the age of 3. And then lo and behold, 3 months later, I was diagnosed. So as an adult. And I always say I got my asthma from her, but I don't think that's quite how it happened. Since then, my sister was just diagnosed in her 50s, and my mother was diagnosed in her 70s. So, I come by very honestly, I really, truly live and breathe asthma every day. Anybody here have asthma? Children with asthma? Parents, siblings? Okay, a couple. So there's a very strong genetic predisposition, obviously. And in the mid to late 90s, we were seeing a trajectory of asthma morbidity and mortality rates. And we really couldn't put our finger on it. This was just when the guidelines were starting to come out, and we knew that asthma was becoming a major health crisis. And that's when a lot of coalitions, local coalitions, were starting to spring up around the country. And people were really taking a hard and fast look at asthma education. How are we educating these folks with asthma to prevent those adverse events from occurring? And we were following on the heels of the National Certification for Diabetes Educator, which preceded us by a couple of years, and sort of followed also on the heels of a national certification process in Canada that developed in the late 90s. So the board itself is a voluntary health certifying board. It was created in 2001. The very first exam was offered in 2002. So we're approaching our 10th anniversary of the very first exam that was offered. The purpose of the board is to prepare these examinations to test the qualifications of candidates for certification as asthma educators. And then we also conduct and evaluate these examinations. We use a scientific process. We use an exam testing company, and everything is done in that way on a national level. The exam categories are 4, and you can see the percentage of test questions and breakdown of how those different areas are weighted on the actual exam itself. The asthma condition is 20%, patient and family assessment is 26%, asthma management, overall management is 43%, and organizational issues is 11%. And the last section, organizational issues, are things like program development and outcomes and evaluation and that sort of thing. And the exam categories were actually created as a result of the initial job analysis that was done more than 10 years ago, before the exam was written. All of the asthma educators that we could identify at that time in the country were actually surveyed and asked, what do you do in your role as an asthma educator? And then that job analysis was just redone a couple years ago, and we updated that analysis to find out, are you still doing what you said you were doing 10 years ago? Has your role, has your job changed at all? Have your responsibilities changed? So the exam is always in flux and in process. It's really a living, breathing entity. It's never hard and fast. There's always a couple forms of the exam that are out at any given moment, and the exam is constantly undergoing revision. So the exam itself, there are 175 multiple choice questions. There's no essays. fact, the very first time I took the exam, I was sitting next to a colleague of mine in one of these exam testing centers, and I was really focused on this exam, and my whole career depended on this exam, and I was taking it, and I heard him typing away, and where are the essay questions? And I was looking through the whole thing. There are no essay questions, but you had the ability to comment on items you didn't like. So he was commenting on all these. I thought, I just want to get through the exam. I don't care about comments. But there are no essay questions on the exam. It is all multiple choice. There are a couple multiple as well. There are 150 test items that actually count towards your score. In addition to that, there are 25 pre-test items that don't count, but you don't know which actually items count and don't count. So you are taking an exam of 175 items. You are allowed 3.5 hours to take the exam. It's usually in a testing center like an H&R Block office. You can schedule it online through our website. And there are multiple forms out at any given time. There are sample questions, and review references are available in the candidate handbook that is on our website, naecb.org. And then we also have a self-assessment exam, which is available for $65, and that allows you 3 months access to this online mini exam. It's 75 items. These items are taken out of the same bank that the actual test items came from, but it gives you the correct answers for those items and the rationale. So it really gives you a sense of how the real exam is structured. The exam eligibility requirements, are you must be a currently licensed or credentialed health professional to be admitted to the examination. So you have to have one of the following credentials: physicians, PAs, nurse practitioners, respiratory therapists, pulmonary function technologists, pharmacists, social workers, health educators, physical therapists, and occupational therapists. However, if you don't have a health credential, you can still take the exam if you can demonstrate that you have provided, 1,000 hours of direct patient asthma education experience. So in other words, someone who might be an MA but doesn't have a health degree, or a community health worker. We have had community health workers sit for and pass the exam as well and become certified asthma educators. So there is that caveat. You don't have to be a health professional if you have 1,000 hours of direct patient level asthma education experience.
Karen?
Yes?
Is there documentation needed to prove your hours?
There would be documentation. That doesn't mean that we ask for it of everyone. We will audit sometimes those 1,000-hour candidates, and we'll do the random audit, and we'll see if they do have that documentation in place, but they should be prepared to demonstrate that. The fees are $295 for a new candidate, and if they're successful, the certification designation is AEC, Certified Asthma Educator. They receive a lovely certificate from the board, and the certification is valid for 7 years. If you are not successful, you can repeat the exam, and there's a mandatory 90 days waiting period between the first and the second attempt, but no more than 3 attempts are allowed. And there is a reduced fee for the second attempt, and that's $195. And then recertification currently is by examination only, and that's every 7 years, and there is a reduced fee of $50 reduction there, $245. Now, we've been asked if there are other opportunities or other pathways to recertification, and as a board we're looking at some opportunities, but we've not really made any determination yet. We're still trying to do a data analysis of what that would look like, but currently the only way to recertify is by examination. And I will tell you that the national pass rate for a first-time candidate somewhere 67 to 69%. Now, that said, I know that sounds kind of low, but if you think about it, it is really a multidisciplinary type of exam. It's really one of the few where you will have a physician, a nurse, a respiratory therapist, a community health worker, people from all different disciplines sitting for the exam. Unlike when I took the NP exam, it was at about a 94% pass rate because you have the same kind of pool sitting for that exam. This is a little bit different. But the good news is that people who sit for the exam to recertify, the pass rate is about 99%. So if you pass it the first time, you have a really good chance of passing it the second time. So we're going to look now at a case management model for asthma from my neck of the woods, from the Asthma Network of West Michigan, located in Grand Rapids, Michigan. And this is a map of our state, as you can see. And I always, bring my state in my hand. We call it the mitten state because it looks like a mitten. And this is Detroit over here on the east side, and we are right over here on the west side. We're about 2.5 hours west of Detroit, about half an hour off the coast of Lake Michigan. We're the second largest state in Michigan. And we were established in 1994 We are a West Michigan-based multi-organizational community partnership. We began providing home-based case management services in 1996, and we obtained our 501c3 nonprofit status in 1997. And we contracted with the area's largest payer in 1999. I'll go into that in a little more detail later. We were the very first asthma coalition in the state of Michigan, one of the first in the nation. And then when we formed in actually 1994, there were just a handful of coalitions cropping up around the country at that point in time, and we were one of the first. And before I go further, I want to just give you a sense, because I heard some really amazing data this morning about the state of asthma in Maryland, and just wanted to show you what it looks like in Michigan. It doesn't look all that different. We're really dealing with a lot of the same challenges that you are in Maryland. And we've got Detroit, which has the highest morbidity and mortality in the state, as you have Baltimore. So there's really a lot of similarities there. But we have maybe a smaller population overall. But we have about 250,000 children and over 500,000 adults who currently have asthma in the state of Michigan. Over half the adults in Michigan with asthma had an asthma attack in the past year, and 20% of Michigan adults with asthma are experiencing asthma symptoms every day. So we are seeing the same types of issues with individuals with asthma that is not well controlled. And just as you showed here in Maryland, we're seeing the highest hospitalization rates in children 0 to 4, and hospitalization rates for African Americans are 4 times the rate of those for Caucasians. So 4 times the rate. I think maybe you had 2.5 times, and we might be a little worse than that. 4 times the rate. In addition to that, in Michigan, I don't know what the mortality rate is here in Maryland, but we have about 150 deaths every year in the state of Michigan, every year in Michigan from asthma. Of those, 10 to 15 are children. Every year. 2009, 2010, I'm sure we've had a couple right now, in 2011, there are children dying in Michigan from asthma. And I sit on the pediatric asthma mortality review panel. So we look at all the asthma fatalities in the state of Michigan. Every year we review those cases. And we have the access to their next of kin interviews if they agree to do that. We have their autopsy reports. We have their medical records. If they had Medicaid insurance, we have their pharmacy utilization records too. So we've got sort of the 30,000 foot view of that, and we can see, I call it Monday morning quarterbacking. We're seeing after the fact, all these red flags that had cropped up, because in my mind, virtually every asthma death is preventable, especially in children. We shouldn't see anyone dying from asthma in 2011 with everything we know about it, with the wonderful guidelines we have, the medications we have to treat it, and yet we have children dying still. And we're just seeing very heart-wrenching cases of children still dying. And there's one case that I can think of that we just reviewed this past year. It was an 8-year-old girl who died from asthma. And in her medication summary, we saw that they had refilled her albuterol inhaler 14 times in the year prior to death, and her albuterol nebulizer had 6 times in the year prior to death. So she had 20 refills of albuterol. I mean, first of all, how does that happen? And then second of all, we also had her medical records, and she had seen her primary care provider 8 times in the year prior to death. So we were able to see what was prescribed for her, and what treatment that was given to her. And how many scripts do you think she had for inhaled corticosteroids? Zero. So that's still happening. In Michigan, and probably in Maryland as well. But you have to wonder how that's still happening today. And the mortality rates are significantly higher among blacks and whites. In fact, in Michigan, the mortality rate for children is fortunately very small, but still, we're seeing that 6 times the rate for African Americans than Caucasian children, 6 times the rate. And in Michigan, asthma is the leading cause of preventable hospitalizations in children, probably the same in Maryland. And we were demonstrating some progress towards the Healthy People 2010 goals. Now I know we're looking at the 2020 goals for hospitalizations overall and among whites, but conversely, those rates for blacks were actually moving away from the target. They were getting worse.